I'm Dr. John Mann. I work at the Roanoke Orthopedic Center in Roanoke, Virginia. I've been in Roanoke in practice for 12 years. During that time, the first 5 years, I worked as the Assistant Director of Orthopedic Trauma at Korean Roanoke Memorial Hospital, which is a Level 1 trauma center. And now I work at the Roanoke Orthopedic Center. I've been working with Virginia Prosthetics since my time in Roanoke, about 12 years. Fitting prostheses for below the knee and above the knee amputation patients. In addition to that, as my practice has migrated more toward sports medicine, I've used Virginia Prosthetics for bracing of athletes, as well as post-operative braces in for any type of knee surgery or hip surgery that requires a brace. For the prosthetic patients, in particular the amputee patients, one of the key things that Virginia Prosthetics has been able to do for those patients is if the patients are in the hospital facing a major surgery which may require an amputation, the prosthetists from Virginia Prosthetics have been willing and are quite eager to come over and talk with the patients and give them some idea of what prosthetic fitting and the whole protocol with regards to prosthetic fitting and physical therapy entails. They also are eager and helpful in having those patients meet someone who's had an amputation, and so they can relate to someone who's actually had an amputation and someone who knows the process from a personal standpoint. And I think that in particular is very, very helpful in easing the patient's mind about their possible or upcoming amputation. I think one of the greatest challenges that a new amputee will face is really the coming to terms that they need an amputation. They actually go through a grief process of a loss of a limb, the acceptance of the need for it for their overall health and well-being, and then the process of understanding the rehabilitation and the prosthesis fitting is also a big challenge for them. Obviously, if they have a tumor and they need an amputation because of a bone tumor, it's a life-saving event to have an amputation. A severe infection that cannot be cleared, which happens occasionally, does require amputation to, in a sense, rid that patient of a deep bone or joint infection. In that sense, they can become much more functional once they've had the amputation versus before the amputation, when their joint, knee or ankle may be very, very painful all the time. They're limited on their ability to get about. After an amputation, they're able to get around without pain, much easier. In a patient who is involved in a high-energy motor vehicle accident or a motorcycle accident, if they have a significant tibia fracture that has an open wound that either will need a muscle transfer, say from the back, a big muscle on the back called the latissimus dorsi, sometimes has to be grafted to a blood vessel to cover the exposed bone. The bone has to be fixed to heal. If that for some reason can't be accomplished, or if the bone just is too deficient of bone material to heal, then oftentimes an amputation is a much more rapid means of recovery for that patient, and really their overall functional outcome will be much better than if they were attempted to have a limb salvage. I think having someone from Virginia Prosthetics see the patient ahead of time is crucial to go over the initial rehabilitation process. The wound healing phase is very important initially, and during the wound healing phase following an amputation, oftentimes they will put what's called a shrink stocking or a shrink sock on the amputation to help it begin to form very early on in the healing phase. Oftentimes we will also put a patient in a cast immediately in the operating room to help with swelling control. After that cast comes off, then they'll go in a shrink sock, and then they can even be fitted with a provisional prosthesis. Sometimes that provisional prosthesis can go immediately on the cast that we apply in the operating room, so that patients can get up right away and begin putting some weight on that lower extremity. I think having someone who has a prosthesis come and talk with them about the overall process, how they themselves have gone through the process, is very, very helpful. Making sure that the patients understand that their function may be much better than it could be otherwise if they chose to salvage that limb. That's a difficult thing that I have talked with patients about. Oftentimes a limb is so severely injured that to salvage the limb will require multiple surgeries, and even with multiple surgeries will still leave them with a very painful, stiff limb that really will make their overall function and activity level very low. To have them talk to someone who has either a below the knee or above knee prosthesis, to have them talk with the patient about their experience of losing their own limb and the prosthetic fitting that comes after that, is incredible. It really is much more helpful than anything that I can tell them. Doug Call and Charlie Coulter, both from Virginia Prosthetics, went with us on a medical mission trip to the Dominican Republic. I've been going on a medical mission trip with our church, heading it up as a medical director for 8 years. And the Dominican Republic is a very poor country, obviously. Orthopedic care there is not nearly as advanced as it is in the United States, what we appreciate here. Motor vehicle accidents, and particularly moped accidents, are very, very common there. Orthopedic care for those injuries is I guess I would say, antiquated at best. Infection is very common, and the management of those infections there can only be dealt with through an amputation. So there are multiple patients that I have seen in the last 8 years in the Dominican Republic who have either below the knee or even more commonly above the knee amputations. And those patients have been doomed up until this visit when Doug Call and Charlie Coulter went to the Dominican Republic with us to getting around with crutches and were unable to do any type of work. So having them there, seeing patients, was a great thing to see. During that week, Doug Call and Charlie Coulter saw 23 patients. The most dramatic one was a 16-year-old who had had an amputation as a child and had never been able to walk. And to see them fit her immediately with a prosthesis during one day and have it fitted on her by the afternoon and walk out of that clinic was very dramatic.